Hi everyone, welcome back to my channel and you're watching The Brown Feminist. So in today's episode, I will be answering one main question that I've been asked a lot by all of you. And that is, when you've been practicing as a nurse at the bedside for a while and you've never really been a research nurse, then how exactly can you transition from the bedside to the world of research? So without further ado, let's get into it. Now, when you're trying to transition from nursing bedside in a hospital setting, long-term care, or clinical work where you're working with your hands, you're doing shift work and all of that, and you're trying to transition into something very, very different, but still a field that really prizes nurses, then you really have to go back and look into your toolbox and see what you have and what you don't have to offer. So if you do have a background in nursing, particularly if you are a registered nurse in North America, then you have quite a few things to offer. For example, you have a full-fledged bachelor's degree, most likely. Most of the countries nowadays need 4 years of bachelor's training to give out their RN license. So let's assume you have a full bachelor's degree. During that bachelor's degree, you did have to do a lot of in-depth theory on physiology, anatomy, research methods, and then health determinants and all of that, maybe a little bit of public health kind of things. That is all a bonus that you have in your toolbox to offer to clinical nursing. Number 3, you have a lot of experience working and interacting with patients, right? Not a lot of people have that because you've been in a position which allowed you to have those interactions, to be comfortable in dealing with people with dementia and children with special needs, in dealing with people who are in states of distress or undergoing surgery and high risk factors, or people who are aggressive and all of that. So your experience in dealing with patients is a plus that you need to mention and sell to get that clinical research role. Number 4, you are very confident about your understanding of ethics, privacy, confidentiality. You're not going around at the hospital like taking photos with your patients and uploading them to Instagram, right? So because you have this very innate understanding by the time that you are a full-fledged nurse and you've been working at the bedside, all of that does tie back in with patient ethics. Compared to many other people who haven't worked with human subjects, you have a deeper understanding of, how to make sure one patient's privacy is safe from other people, whether they are guests, they are visitors, they're other patients, they are people in the clinic who are outside of their circle of care. So this whole understanding of patient ethics and privacy and confidentiality will come in very handy, so sell it. So all of these things are things you're bringing in. On top of that, if you have extra clinical skills, for example, some research nursing roles require, a little bit of venipuncture, right? A little bit of phlebotomy, a little bit of various kinds of assessment tools, as well as various intervention tools, which might need to be delivered for patients in a clinical trial. So you also have that ability to either carry with you those skills or quickly learn those skills because you've been learning skills all your life, right? You've been a bedside nurse, whenever there's a new kind of technique, you are getting the training and you're ready to go and apply it with your patient. So that is also a skill that you're bringing with you. So you list all of it down in your resume, and if you would like help with that, comment down below and I will make another video of how exactly to demonstrate these skills in words on your resume and in your interview. Now let's see what are the things that you are lacking. Things that might not super prepare you to be a clinical research nurse, and things that you will have to make up throughout your interview and in your resume. Most nurses who've been working exclusively at the bedside are not really up to date with research methods, with the kind of trials they're doing these days, what new methods may be used in them, a lot of data entry. You might not be super tech savvy beyond like doing your patient charting. You might not have a very good understanding of shipping biological samples outside of the hospital's protocols. You might not have a lot of idea about submitting a research ethics approval and like communicating with people outside of your patient care, like with other collaborators in the research world, writing a research paper, or doing analytics, developing charts and graphs and stuff like that. Well, you know what? That's okay. A lot of the times when these positions in clinical trial are hiring, and they're hiring with the title of research nurse or research nurse coordinator, they don't expect you to do a whole lot of those data stuff. And if they do, you'll find a way to learn it. You can go back and do a little bit more schooling online in the evenings or on weekends and do a quick clinical research certification online from a credible organization, just so that you learn or are reminded of some of these methodologies, some of the new ethical requirements and standards, some of the formats for submitting like a research ethics approval and amendment request and following a protocol and things like that. Maybe you want to learn a little bit of data analysis as well, a little bit of using a few softwares and writing lit reviews like you did back in university. But for the most part, if somebody is hiring for the role of a research nurse or a research nurse coordinator, they're banking on your clinical skills. They're banking on your ability to work with patients, to keep tabs on them, to recruit them, to consent them, to perform assessments or to do interventions as for the clinical trial, to maintain the privacy and confidentiality of the whole process, and just to be in a leadership role as well. However, having said that, there are fewer positions which have these titles, right? There's a lot more clinical research roles which don't have the word nurse in it. And you still have the right to apply to all of them. There's a huge field and a huge shortage actually of of research coordinator, research associate, research assistant, research program manager, and nurses are definitely in a very good position to go and apply for those as well. So how do you sell those skills? Exactly as I mentioned. If you think that a certain position, based on what they have written in the qualifications requested and the expectations in the skills section of the job, and if you think you're missing some of them, that's okay. Show what you have. You have a whole toolbox full of experience that you can use and transition on here, right? Remind them in your resume that these are the courses I did in my undergrad. And guess what? I'm enrolled in like this online clinical research certification as well. So I'm brushing up on that. Things like that will really, really help as well. If you've ever done even a little bit of research, maybe during your undergrad, during like a summer semester, assisting, volunteering, those kind of things, mention that. But at the same time, recognize that a lot of these things might not be in your forte. Like for example, project data management is a specialized part of clinical research world that, for example, is not in my forte. And I'm like, okay, I don't want to be the person who's learning coding and doing like specific algorithm-based data analytics. I want to be in the more clinical aspect of clinical trials, and that's okay. There are plenty of jobs out there which, with or without the name nursing in the title, will still have a lot of room for people with the clinical training. The clinical training is what's hot and it's in demand, and that's why nurses make such excellent research coordinators, associates, assistants, and just even project managers. So the rest of the things, as you're moving up from clinical research assistant, associate, coordinator, project manager, you'll pick up the people skills, you'll pick up like the protocols that each of the hospitals or the CROs kind of use. You'll know, okay, this is where I go to find the template for that form, for the RAB approval. And then this is how I modified it. This is what kind of language I used to kind of show that, the protocol had to be changed a little bit at this side because of this reason. This is how I file like an incident report form. This is what happens when a participant drops out of it. So a lot of it will come from hands-on training and exposure. So the sooner you can get started, the better. In fact, if you haven't found a clinical research role yet that is significant enough that you can just leave your nursing job, maybe it doesn't pay that well, maybe it's not full-time, try to still do it. If you can do it part-time, if it's possible for you to do a few hours a week at your clinical research role, that would be an excellent way to get started. Maybe start off at a much lower role while you keep your nursing full-time job and you're doing a little bit of part-time RA-ship just to help out maybe a small CRO kind of company, or just to assist a professor at some university with one of our new upcoming trials. They don't have a big budget and you're just donating like maybe 10 hours of your time, or maybe it's a paid position, but just 5 or 10 hours of your week or weekend. And by doing that, you will have gained all the other experiences that you need in order to go ahead and apply for like a broader clinical project manager or clinical coordinator role. So there are many different ways that you can overcome the few lacking skills that you might have as someone who's just been by the bedside. So whether or not you've been an ICU nurse, a med-surg nurse, someone working in long-term care, all of that, it's definitely possible for you to move into clinical research. In fact, I think you're an excellent candidate for it. They're always looking for nurses with strong theoretical background and understanding to move to clinical research. Now, on the chance that you did not do an RN, you did not do a bachelor's degree, you did an RPN or a college diploma or certification in nursing, and you've been practicing at the bedside, what my personal recommendation to you is to go back and do a bridging program if you can. A lot of them might have flexible schedules for people who are actually working as nurses part-time, and you can do a one-year bridging program to upgrade your degree to an RN. And the reason I say that is that the RPN programs, the college diploma programs, often do not give you a strong foundation in theory and research background, right? Research methodologies in health sciences, in nursing, or in the clinical world. So it is kind of important that you definitely do that additional bit of schooling before you start applying to research roles, unless that research role just wants your clinical skills. There are some niche clinical research roles which are just looking for an RN. They don't need you to do much in research, and whatever they do, they'll make up for it in your training. Then it's fine. But for most of the time, if an RPN, you're not finding a good full-time position as a clinical trial coordinator or manager in the world of clinical research, it's probably because your degree does not cover a lot of those foundations. So either doing that certification, going back and upgrading to becoming an RN, all of these are excellent choices to make as you plan to move away from the bedside and into the world of clinical research nursing. So I hope that video has been helpful for all of you. And if you have any more questions, please do comment down below. I would be more than happy to answer your questions. If you have additional feedback for me based on your experiences, please do let me know as well. I would love to learn through your experiences too. So that's all for today's video. I hope this has been helpful, and have a wonderful weekend. Bye.